Good evening. The latest in the prevention and fight against HIV/AIDS with Dr. Michael Harbour. 15 directors collaborate on a feature-length documentary on people living with HIV.
Supposed to be love often runs away to hide from the question, leaving only me to ask, why do I have this inside?
HIV/AIDS resources in Santa Clara County. More details with James McPherson. Director David Weissman creates the first documentary on 5 San Franciscans who lived through the AIDS epidemic.
The first time I heard about AIDS, I think it was called the gay cancer.
And our annual Outlook Video Christmas video on this special World AIDS Day edition of Outlook Video.
And welcome to the World's AIDS Day edition of Outlook Video, your nationally recognized, award-winning news magazine for gay, lesbian, bisexual, and transgender communities. I'm Roberta Gonzalez-Gregg, wishing you and everyone season's greetings from the month of December.
And I'm Christine Hancock, saying happy holidays to you and everybody. On this special edition of the program, we focus our attention on AIDS-related topics for World AIDS Day. The World Health Organization established December 1st as World AIDS Day in 1988 to provide governments, national AIDS programs, faith organizations, community organizations, and individuals with an opportunity to raise awareness and focus attention on the global AIDS epidemic.
Returning guest Dr. Michael Harbour is now the U.S. Director of Medical Affairs for HIV at Merck & Company. He talks with Tom Smith on the continuing prevention and fight against AIDS, which is still around after 30 years.
And with the epidemic well into its 30th year, the estimated number of newly infected people in the United States is over 56,000. Over 1 million people are living with HIV in the country, and a staggering 36 million are estimated as living with HIV around the world.
The HIV Story Project commissioned and produced 15 short films which portray people living with HIV/AIDS from the San Francisco Bay Area. The end result is Still Around, a feature-length compilation that weaves a diverse slate of stories into one powerful video AIDS quilt of our times. Raymond Donald Hong talks with some of the directors from that collaboration later in this half hour.
Also on the program, we'll be interviewing James McPherson. McPherson is the Senior Healthcare Program Manager for the HIV/AIDS Prevention and Control Program, part of the Santa Clara County Public Health Department. James McPherson will tell us what resources are available from the program to prevent HIV/AIDS, and for those already HIV positive, what support is available to help them in their daily lives.
During the 70s, San Francisco was known as the gay Mecca, where men all over the country in their prime flocked to the city by the bay to live in a more accepting environment to experience their sexual freedom.
But when the community entered the 80s, that utopia faded away when what was called the gay plague and eventually acquired immune deficiency syndrome roiled the city for 2 decades before granting some reprieve with medical advancements in the late 90s.
We Were Here is the first documentary taking a reflective look back on the arrival and impact of AIDS in San Francisco. Director David Weissman talks with Raymond on how the film explores 5 individuals who were affected by the tragedy and how they triumphed over the epidemic.
And finally, stay with us on the program as we premiere this year's official Outlook Video Christmas video. None of us have seen it, so it's going to be a surprise.
Oh, my mind is running wild. But first, Dr. Michael Harbour.
I'm Lisa Cholinenko, and I'm watching Outlook Video.
When Dr. Michael Harbour was last on our program, he was a clinical associate professor at Stanford University School of Medicine. He is now the U.S. Director of Medical Affairs for HIV at Merck & Company, and he'll tell us what's new regarding the prevention and the fight against HIV/AIDS. Dr. Harbour, thank you for coming to our program.
Thanks for having me, Tom.
So let's get to it right away. What is new in the area of prevention?
So for prevention here in the United States, still all of the same rules apply, that people should be taking great care in having sex, using safe sex methods and condoms.
So follow the guidelines for safe sex.
Exactly, still continuing to do that. There has been some new research into looking at pre-exposure prophylaxis for men who have sex with men. This is a research field right now that some of the HIV meds that we're currently using to treat HIV-infected patients can be given preemptively or prophylactically to HIV-negative patients in hopes of reducing transmission. The use of Truvada was one of the drugs that was studied here, and they did a large study of 2,500 men who have sex with men, where half of them were given a placebo pill, the other half were given Truvada, along with education about safe sex, the use of condoms, treating aggressively sexually transmitted diseases, and the incidence of HIV transmission was reduced by about 44% in those who faithfully took the medication.
So that's pretty significant.
It's a significant finding. It shows that perhaps in patients who have high-risk behaviors, some medications can be used along with the traditional and standard ways of decreasing infection. Although medications do have side effects, a lot of cost associated with them, but we're getting to be improving on the system and hopefully decreasing HIV infections.
So which group of people right now is most apt to have new infections?
So we still have about 40 to 50,000 new infections per year in the United States.
Wow.
Out of those infections, we still see the majority occurring in men who have sex with men. Unfortunately, many of the people who are getting infected now are still young men who have sex with men, and young minority African American men are making up the majority of those cases. So about 14% of inhabitants of the country are African Americans, but the new HIV infections are about 40+% are young black men who have sex with men. And so, again, a big disproportion. So we need to be targeting our message to that community and making sure that we get the message to those people that they need to be aware and to take precaution and to have safe sex.
Talk to us, if you would, about the U.S. National HIV Strategy.
So last year, a U.S. strategy was implemented for the first time in the history of the epidemic here in the United States, targeting goals for HIV treatment in this country to try to reduce the number of new infections, but also to get patients on therapy throughout the country so that new infections are rare and anyone who needs treatment will get treatment. So it is a comprehensive plan that the president put out here. Interesting that we never had one before.
Do most people know about this? Because I hadn't really heard about that until talking to you.
It's been out there, whether people are paying attention to it or not. It is a plan.
Excellent. You know what? Our time is up, believe it or not. It's always so fascinating to talk to you.
Well, thank you for having me.
So, Dr. Harbour, thank you for sharing what's new in the fight against HIV/AIDS. It's a privilege to have you on the show, as always, for our World AIDS Day. And for more information regarding the testing and treatment of HIV/AIDS, please contact the PACE Clinic at the Santa Clara Valley Medical Center at 408-885-5935. Coming up after the break, the 15 film collaboration Still Around. You're watching Outlook Video.